My name's Njoki from Muungano Wanavijiji, Kenya, a community leader and also a national leader in Nairobi, Kenya. I think one of the challenges we have in promotion of urban health is the overpopulation, and due to rural-urban migration, it's so congested, and we have limited resources to be able to address or promote the health. So basically, the kind of the housing they are living in and the congestion is a big challenge when we want to address the issue of the public health. Also, we have the overstretched resources, the issue of water. Water is limited. We have so many people sharing a water tap. So it's also, and water is basic. Water is also basic for health. Without water, you can get so many people getting water-related ailments. You can have cholera, maybe cooking food which is not clean. So you have so many issues of illness. Also, the healthy systems, we have very limited number of hospitals, and if they are there, they are a bit expensive. The communities are not able to afford the cost of medication because the communities, most of the people in the communities are living in below $1 a day. Even their nutrition, they are not able to eat healthy diets. They are not able to eat even enough foods, enough amount of food to sustain their health. So basically, like in Kenya, for medical cover, it's like $5 in a month. This is out of reach for most of the community members. So I would also like to look at what Muungano Wanavijiji, what we practice, or what are our practices in networking and also in programs. So I think like Muungano Wanavijiji, which is a movement for the slum dwellers. We mobilize, we organize, and we form groups. So what we do, we have a strength in having community groups, and they become community groups, and also they become savings groups. So we like using savings group because these are centers for passing information. These are our first centers for advocacy. So we do settlement, village-based community groups. So when we have village-based community groups, these are the centers where we will use to pass information. If we want to advocate for something like sanitation, something like water, this will be our point. We also promote settlement resident association. So it's at a larger level. Like we did that in Mukuru, where we want to promote inclusivity and leaving no one behind, where all members of a community are able to join in an association, and this can be better. This will help. This one will help in advocating and also co-production on issues which are affecting the settlements. As we practice peer-to-peer exchanges, we believe when communities visit each other groups, they are able to learn. You are able to learn more when you see than when you hear. So basically, we do learning exchanges on housing, we do learning exchanges on saving. Nowadays, we are doing learning exchanges on climate action. So you take some community members, maybe for instance, you are coming from Nairobi, you can go to Nakuru to see the housing project, also to see the climate effect on the area. So basically, we do peer-to-peer learning exchanges, and it has proved to be a very good tool. Recently, we've been doing this in Mathare. This is basically to collect data in our community, be able to highlight issues which are coming out, challenges which you are seeing in the community. And this is purely, it is done by the community members with support from our support organization. So this gives the community the ownership and also the will and the zeal to be able to go and advocate for what the challenges which have been highlighted in the process. Some researchers have an effective community participation process. We have some research firms or research institutions who come to the communities with predetermined questions without involving the community. So they will come with predetermined, and the predetermined question can give an outcome which is not favorable to the communities and would not be in a position, the communities cannot be in a position to uptake the outcomes from the research. So basically, you could have a very good report, very good proposal, but the politics of the day and the political strength which is in your area that is not the agenda. If your outcomes do not rhyme with the political agenda, so it might be difficult for uptake. So what I think can be gained from joining and expanding or linking to community practices, I think it will lead to increased co-production of knowledge. The community is able to understand and also being able to follow up on action points from the research that has been done. So the community is able to follow up, advocate for what they want to advocate. So it will lead to better provision of services, informed provision of services, and also there'll be diverse perspective to empower decision make. So basically, what can be gained is to have sustainability of projects, sustainability of programs, and also community ownership of the processes which are being undertaken. Thank you so much.